Navigating sexual health choices can feel like deciphering a complex map, especially when personal values and medical definitions come into play. When we talk about preventing pregnancy and sexually transmitted infections, understanding the precise meaning of terms is absolutely crucial for making choices that truly protect you. At its core, abstinence means avoiding all forms of sexual activity that could lead to pregnancy or the transmission of sexually transmitted infections. This primarily excludes vaginal intercourse, which is penetrative sex involving a penis and a vagina. However, for comprehensive prevention, it also typically excludes anal sex and oral sex, as these activities can transmit infections. The reason for this broad definition stems from the mechanics of how pregnancies begin and how infections spread. Pregnancy occurs when sperm fertilizes an egg, which is most commonly achieved through vaginal intercourse. Sexually transmitted infections, or STIs, are passed through the exchange of bodily fluids such as semen, vaginal fluids, and blood, or through skin-to-skin contact in specific areas. Therefore, any sexual activity involving these exchanges carries a risk. True abstinence aims to completely eliminate these pathways, providing the most effective method for preventing both pregnancy and STIs. To practice abstinence effectively, it is vital to communicate openly with any partners about your boundaries and definitions. Make sure everyone involved understands and agrees on what activities are considered off-limits. This means clearly defining what constitutes sexual contact for you, ensuring that both partners are on the same page about avoiding penetrative sex, oral sex, and anal sex. If you are unsure about a particular activity, it is always safer to consider it a form of sexual contact that breaks abstinence from a prevention standpoint. Interestingly, some people choose to engage in what is sometimes called intercourse. This term refers to sexual activities that do not involve penile vaginal, penile anal, or oral genital contact, and therefore generally do not involve the exchange of bodily fluids or direct genital skin contact in high-risk areas. Examples might include mutual masturbation without direct genital contact, kissing, or intimate touching. While intercourse is generally considered a lower-risk activity for STIs and pregnancy, it is not strict abstinence if any risk of fluid exchange or genital contact remains. Also, the term secondary abstinence is used when someone chooses to return to abstinence after having been sexually active. Ultimately, choosing abstinence is a powerful and personal decision that offers the highest level of protection against both pregnancy and sexually transmitted infections. By understanding that abstinence extends beyond just vaginal intercourse to include anal and oral sex, you can confidently make informed choices that align with your health goals and provide you with complete peace of mind.